Hi, my name is Donna Davis. I'm a member of Patients for Patient Safety Canada. The theme of World Patient Safety Day is Patient Safety from the Start, Safe Care for Every Newborn and Child. Patient Safety Day is on September 17th. This is the story of my grandson, Asher. Our Asher boy was born on September 14th, 2016, with a mass of dark hair, chubby cheeks, and the cutest dimples. He was perfect in every way and thrived on breastfeeding. When Asher was about 6 months old and growing like a weed, his mom gave him a quarter teaspoon of baby food custard to start him on a little food. He smacked his lips and took it well. That was enough for a first try, though. An hour later, my son-in-law came running over in a panic. "Something is wrong with Asher. Please come quick." We live right next door to them, so I was there quickly. The sight that met my eyes when I went into the baby's room struck terror in my heart. There on the floor was my daughter trying to change Asher's diaper as diarrhea poured out of him. He had had projectile vomiting too, she told me. He was still as death and white, so white. As a nurse, I've seen dead people. I thought he was dead. I was thinking, oh my God, she has feces and vomit in her hair, and she is changing his diaper. She doesn't realize he is dead. What happened to our lively, beautiful baby? As I knelt down, I could see that Asher was breathing very shallowly. He was covered with sweat. His pulse was very rapid and weak. He had to get to a hospital very quickly. I didn't know what was wrong with him, but he appeared to be in shock and was very sick. We called ahead to the hospital 35 minutes away from our home. The nurse who examined Asher was very concerned for him. This was a very sick baby. The doctor that examined him was not concerned. "It's just the flu." He didn't really listen to what my daughter and son-in-law told him about Asher's sudden onset of symptoms and how severe they were. They did keep him at the emergency department until they could further consult with a pediatrician at a hospital several hours away. He advised them to keep an eye on him and give fluids. They did not give him fluids, just advised my daughter to keep trying to nurse him. They didn't keep him at the ED either, just sent them home. The physician also made a referral to a specialist, which later turned out to be a dermatologist, as Asher had a bit of eczema. Asher recovered after several hours and seemed to have overcome whatever was going on with him. He had the appointment with the dermatologist, who then referred Asher to an allergy specialist, as the event my daughter described to him seemed much more serious than a small eczema rash. The allergy specialist examined Asher and listened carefully to the details of Asher's episode. He diagnosed him with FPIES almost instantaneously. He said it was textbook FPIES. FPIES is food protein-induced enterocolitis syndrome. It is a rare delayed food allergy that causes symptoms usually 1 to 4 hours after eating a trigger food. It is often diagnosed in infants and young children. Symptoms can be very serious and include dehydration from severe vomiting and diarrhea, severe lethargy, often being described as floppy, paleness, becoming very cold and shocky. It is different than the other food allergy reactions that cause an allergic response throughout the body. FPIES response is confined to the gastrointestinal system. The specialist, who was fantastic, provided them with an information sheet on FPIES and a treatment protocol to provide to their family doctor and local ED for any further episodes Asher may have. When my daughter took Asher for a follow-up with the same doctor they saw in the ED during Asher's first episode, and she explained the diagnosis and showed him the treatment protocol, he suggested they get another opinion, as he felt the specialist was just placating a neurotic mother. My daughter was taken aback by his comment. They were a very healthy family. She had rarely, if ever, had her 2-year-old to the doctor, and this was the first time taking Asher. Why would he label her as neurotic? He said he did not believe the diagnosis to be accurate and that he had never heard of FPIES. He refused to acknowledge the treatment plan or ensure the medication to treat Asher would be available in the ED. This caused distress and fear for all of us who had seen how sick Asher was when he had the FPIES episode. With the diagnosis of FPIES, the risk of exposure for Asher was significant, especially as he got older. The list of everyday products and food with milk protein as an ingredient was extreme, and even the smallest amount could cause Asher to go into shock. They carried an EpiPen with them. It was explained to them that the EpiPen wouldn't stop the reaction, but may provide time for them to get to the hospital to get treatment. Since the family doctor refused to acknowledge FPIES, I contacted a nursing colleague at another hospital in our area, explaining this situation to her. She immediately agreed to have the medication available at her hospital. What followed for the next 3 years was very careful examination of every morsel of food or drink that was given to Asher. Thankfully, he grew out of the FPIES and is a healthy, active, lovable 8-year-old. It could have been different if the specialist had not been so willing to listen and hear what Asher's mom and dad had to tell him. A completely different interaction than with the family doctor. We don't expect our healthcare providers to know every symptom and every disease. It is not realistic to expect that when there are so many illnesses and some so rare a provider may not even see one case in their career. We don't expect to be put down, have our concerns dismissed and labeled when we seek care for our child who we know better than anyone else. We don't expect defensiveness when the provider is presented with an illness they aren't familiar with. What we do expect is to be listened to, treated with respect, and included in the treatment plan for our child. We expect providers to respect colleagues' expert knowledge and work together as a team to provide the best care for our children. The Emergency Care Research Institute has listed the top 10 patient safety concerns for 2025. The ECRI provides evidence-based insights, resources, and solutions to improve healthcare outcomes and reduce risks. You can find the link to the article on this slide. It has a wealth of valuable information in the article. As you can see, the risk of dismissing patient, family, and caregiver concerns is number 1 on the list. Again, who knows their child better than the parent or caregiver?